almost back to normal.
Okay.
And that's why your kidney function is back to normal. Because when you went in, initially, your kidneys were not working.
Right.
Okay. So the swelling has improved, and your kidney function is back to normal. So we're very happy about that.
So, is he looking at keeping the catheter all the time now because the bladder will not stretch? I mean, will not shrink back.
Right. We'll talk about that.
Okay.
Right. But I'm telling you, the catheter is doing the trick.
Right.
Okay.
Because your kidneys are not swollen anymore because there was blockage,
Yeah.
and the kidney function is perfect. So
Okay.
we're happy about that. Okay. And then in February, you only had 2 spots. You had the jaw swelling and the spot on the spine.
T9.
Right. Now this May, unfortunately, you have 6 spots on the bone. And one of them is where you're sitting down, and that's why you're hurting.
Oh, okay.
That's cancer in the bone, according to the scan. So you have it in the left shoulder, in the ribs, right and left, and then where you're sitting down. Okay? And then, unfortunately now, it's also going to the lymph nodes. Okay, so lymph nodes, bone. And your PSA, initially was 940, it came down nicely, and unfortunately it went up another 50 points. So right now, when you did the blood work today, it's up to 710.
Yeah, we've seen that.
Correct. So where do we go from here? Again, unfortunately, from February to May, it is spreading. Right, you have 5 new or 4 new spots on the bone. And this pain, how are you handling it?
Doing all right.
Okay, not you take Tylenol or anything for
A
it?
few weeks ago, he felt like, didn't you hurt your back? So your back was hurting.
Right.
He thought he pulled something, but it got better.
Right.
But
Was it higher side or lower side?
where was it? The lower.
Okay. Yeah, that's again, you do have a pretty large spot on the cancer, on the lower side where you're sitting down, the pelvis. Right.
Oh.
So this is again driven by, we spoke about the testosterone. Right? So if you knock out the testosterone, your PSA will go to 0. I had a guy, he was 86, his PSA was 1500. Gave him 1 shot. Went down to 1.
Wow.
Meaning the cancer is dead. And he felt so good, he wanted to stop the treatment.
Oh.
So he's never coming
I
back.
ran into a lady at the Cynics in Stanley. She said her husband's name is Alan and he sees you.
Okay.
And I think he's in his 70s.
What's his last name? I
Um,
see a lot of Allens,
trying to think of.
But regardless,
Yeah.
we do use IV chemotherapy. We do use chemo pills. But the lowest treatment you can get is this shot. And you can try it. It only stays in you in 4 weeks. If you don't like how you feel,
It's a chemo shot.
it's not chemo. It's just to lower the testosterone.
And where do you inject that?
Arm, leg, wherever you want.
I was reading, I thought someone was saying right into the penis. I was like, that's weird.
No. Now, if you don't want any shots, then you can let us take out your testicles. Because the testicles is where testosterone is made. And I have 3 patients who don't want shots.
So just
Take out of it.
removing them.
Right.
Will that shrink the prostate?
Right. It will take care of the cancer.
So what about what it says in there about the prostate is invading the bladder?
Correct. That's from the cancer.
But they're not, how did it say that it was like stuck together?
Correct. So it's growing, it's getting bigger because he has good testosterone. So if you take away the testosterone, the cancer shrinks and the bladder improves.
And his testosterone was what, 600 and something, and then it went down to 3?
Right.
But I didn't
Which is
see
normal.
a number this time.
Yeah, they don't have the test, but
Okay.
it's normal.
It's normal.
We want it, the goal is below 50. If you
Oh.
take it below 50, your cancer will die. So you have 2 ways to do it. Either shots, and the shot only stays in you in 4 weeks. Meaning after 4 weeks, it comes out.
So you have to do it again
If you want
after
to.
you see.
Right, if you want to. The alternative, let's say you don't want any medicines inside you, then you can take your testicles out. Because that's where testosterone is made. And your cancer, the PSA the same night you will, the day after you will wake up, it will be extremely much lower. So you have options. So if you look here, this is the left, this is the right. Okay. So you can see the dark, they gave you a dye.
Mm-hmm.
Okay. For this is a bone scan. You can see the ribs. So this is spot, and this is your jaw, because this is the left, right? It's on your left side.
Mm-hmm.
Okay. And this is, the bone.
In the pelvis.
Right, where you're sitting, where you're hurting. This is another one. So, and this is the spine. So, unfortunately, this is arthritis. The black on the joint.
What's this? Oh, that's.
Yeah, that's the urine bag.
Yeah, your
Oh,
bag.
okay.
Right.
That's how you can tell that's the back of you, because it's on your right leg.
Right. So that's the urine bag. So all of this is cancer. So you can turn this off by one shot, or if you don't want shots,
What's this in the shoulder here?
that's arthritis.
Arthritis.
Right.
You have trouble in your arms probably from
Right.
shifting that truck for.
Correct.
Yeah.
Correct. You mean you're not.
So how come this is that earlier?
This is the front. This is the posterior. This is the anterior. So it depends from the front or the back, But this is from the back. It has different phases, like different times from when they give you the injection. But this is the clearest one. Okay, but you can see the ribs, spine, the jaw, and the pelvis. This is the urine bag. They do it times. I think if you look here, it will be at the exact time, but I'm not the specialist. So, what are your thoughts? Do you want to do nothing, or do you want to do testicles out? Dr. Uman.
What is the recovery for that?
It's outpatient. You go home same day. Have guys in their 80s doing it. Testicles.
And a couple weeks off of work? Or
Right. You go home same day. Outpatient. It's like 30 minutes. So if you remove your testicles, your cancer will die, because your testicles are feeding the cancer. So if you don't want to do surgery,
Even the bone?
correct, it will improve. Because if you do nothing, next time she's gonna push you in a wheelchair, because you're gonna be in severe pain. Right? Because it will break. The cancer is eating it out.
but the shot's only for 4 weeks.
Correct. So that's the major advantage of the shot. If you don't like the way it feels when your testosterone is low, the shot goes away in 4 weeks. Your testosterone goes back. If you take away your testicles, there's no going back. It's
Right.
permanent.
Right.
So most people do the shots just 4 weeks. So if we give it to you, it stays in you in 4 weeks. If you like how you feel, then we keep going. If you don't like how you feel, then we stop. But in February you only had 2 spots, now you have 6, right? Your lymph nodes, it's starting to get inside you. It's going to go to the liver, to the lung, so you have options.
Where's the lymph nodes? I mean,
It's really not very clear on this scan,
Yeah.
it's on the other scan.
so what's going on with the insurance? Why they canceled the PET scan?
Yeah, insurance, sometimes they approve the PET, sometimes they don't. It costs
Yeah.
like 12,000.
Oh, really?
This probably cost 4,000, so
Oh,
they want you to get the
For
cheaper
the
one.
CT scans
Right,
and all
they're
that.
cheaper,
I
right.
see.
So they tell us what to do.
That's ridiculous.
I mean, pretty much. But these scans are still very helpful. So again, you have options, and you're the captain of the ship. And if you just want to do scans and keep doing the supplements and the fasting, But so far, unfortunately, things are getting slightly worse. So the scan, this scan is not as clear as that one. But I can transfer here. Yeah, so this would be your left, and this is your right. Yeah, it's not as clear as on this scan, but the other scan, the dark spots is the cancer.
Do you have the PET scans that I did earlier? Like
The one in February, yes,
yeah,
yes,
That's
yes.
what this is.
This is the
CT.
CAT scan you just had.
Yeah.
Right. But again, this scan showed the spots on the bone, the lymph nodes, and the bladder, the prostate. So yeah, you have options. If you wanna, just do the scans and the labs here, I'm more than happy to do that. But we have a treatment that proved it worked.
Yeah.
You might feel much better, and What's your main concern?
No.
Side effects, you will never feel worse than now. You're gonna feel much better.
It's,
Only 4 weeks.
Yeah.
It's a trial. 4 weeks is gonna be out of you.
Yeah.
And if you're fine with how you felt, we can keep going, and hopefully you can get rid of this bag, because the cancer is pushing in your bladder, right? Whether it can come back or not, we can
what
only
is a
try.
TERP?
It's
I've heard
a
of that, but I
procedure.
didn't know.
Procedure that makes the prostate smaller, so the urine bath is more open. Because right now the cancer is pushing on the urethra. When you try to push, it's blocked. So the catheter is opening it up. So what we do with the TERP is we go inside and we remove the prostate.
Oh,
So the urethra, the urine passage is
can
not
be
blocked.
open.
Right. But
Okay.
now it's blocked by the cancer. So this might shrink it. And hopefully you can get the bladder out.
Do you think that would be such a thing? Just a shot try it for 4 weeks. It's not permanent. It goes out of you.
Or if you don't want any chemicals, you can take the testicles out. Dr. Omen can do it.
That's
Probably.
permanent.
Right. That's the problem. Which again, that's more treatment for you. Right. You don't have to keep coming for shots. One time. Right. If that
You
makes
do
sense.
the shots though?
We do the shots here.
Okay.
And depending on the insurance, sometimes we can start same day, sometimes Blue Cross, sometimes they will need time.
What
2 weeks.
is the shot called?
It's hormonal therapy.
But is it Lupron or? a
We have
different name?
Lubron, we have another one called Fermagon, they're all the same. Right, so we have different ones. And this also comes in a pill. If you don't want to do the shot, it comes
Oh,
in a
you
pill
can
form.
take a pill.
Hormonal, but that's every day for a month.
Right.
Instead of taking pills, we can give you a shot, under the skin. But if you don't want shots, we have pills. Or if you don't want any chemicals, then we can take your testicles out. You go home same day. Dr. Omen does it. I had 3 patients, one of them is younger than you. Because we gave him the shot, it did not work.
It did not work.
His testosterone was too high.
Oh,
Good. So what are your thoughts?
I'm kind of set back. I don't know what to think.
Right.
So
But what's your main concern about the treatment? That you're gonna get sick and die sooner from the treatment than the cancer?
I'm just weighing out my options if there's another way to treat it
Right.
without that. Like
Without the
changing
surgery,
something.
I see. Without the surgery, without the hormonal shots?
Yeah.
Right.
the hormone shot's only for 4 weeks though.
Right.
If
One
you
time.
don't like it, you don't have to continue. It's not permanent.
Right.
But you would see if you're
Feeling better,
See
the
if
pain
it
goes away.
changes.
Right. And you can do radiation for the pain. Radiation is another option. You can radiate this, you can radiate the prostate, you can radiate where you
I wish
hurt.
there's a way to do different things than what I'm doing, and then be able to see what's going on in my bones without having to come for scans all the time.
Right.
Can you see the bones with like a sonogram? Can you see that?
Bone scan, CAT scan, PET scan. Sonogram is for soft tissues, meaning what's inside you, not the bone. Right. X-ray can help. Just a regular
X-ray,
right? A regular X-ray, but usually that is not very accurate.
Yeah.
Right. So what we're doing is more detailed.
Do you have to use the stuff in the CT scans, or can you have it with no
Contrast.
contrast?
It will be less information. We might miss stuff. Like the lymph nodes we
Why
saw.
does it say likely metastatic? When it says likely.
Meaning we didn't do a biopsy. Meaning we have to go do biopsy on each one and find out. Without biopsy you cannot be confident. But you had one biopsy before, your PSA is high, so we don't have. But they have to say that.
So you're no longer worried that this is a different cancer. It is the prostate.
Correct.
Because at one time, was it the ENT that said that?
Correct.
Yeah,
That's not a concern.
Okay.
Correct.
that's what I was wondering.
They didn't know your whole picture.
Okay.
Right. So yeah, you have options. We can do the shot later this week, next week. You can meet with Dr. Omen to think about removing.
Now, on that scan, you said this was arthritis.
Right, on the shoulders.
How can you tell that this isn't arthritis?
Because
And-
there isn't a mass.
okay.
All of these showed up as like a circular mass, like sudden activity. The shoulders, and this was what we call diffuse, meaning it's less circumscribed or less delineated. You know, and it's on the joint.
You said you was gonna give us screenshot or pictures.
Yeah, I just showed you.
Yeah.
Yes, but if you want the
okay.
report, the front desk can print you all the reports you want.
Oh,
Right.
okay.
Right. So yeah, think about it and let us know what you want to do.
We're
Okay.
planning on a little vacation first week of June.
Sure. I'm seeing you every 3 months anyway, right?
Is it every 3? It's
With
been
the
kind of
scan.
more than that
Right.
lately, but
Right. Because
yeah.
that's, I mean, I'm seeing him whenever he wants me to see
Yeah.
him. I'm here for you.
okay.
So if you want to do 3 months scans, blood work, if you want to do more, less, whatever you want.
Okay. Yeah, we'll talk about it and
Right.
set something back up in a few months.
Sure.
So
Unless he decides sooner
Yeah,
before we
unless I-
leave
yeah,
to do
sure.
a shot,
Yeah, that might be a good idea.
and we can just call, or
Call
do we
us.
have to wait another week?
No, just call us and then we will submit your insurance.
Oh, and then you have to go from there.
Right. Do you want me to submit your insurance to make it approved? So by when you decide, they can give it to you?
Oh,
You want to do that?
go ahead and submit it just to see if it's approved,
Right.
and
Let
then
them
you can do
approve
it
it. You don't
anytime.
have to take it.
Right.
yeah.
And once you want to take
Yeah,
it,
I would
we
say.
would have safe time.
Yeah, I would say that.
Good. We'll do
And
that.
is there any way, like, on his appointments with you, that we can just have labs done in Stanley before we come?
Sure. We can
'Cause
do standard.
We do them first thing in the morning there, and then we don't have to come and hang out all
But
day in Minot.
sometimes Stanley sends the PSA here. Someone has to drive it.
Oh, really?
Sometimes they don't run it there, so it might take 2
Oh.
days to come back. Right.
Well, see, it takes 3 days? Oh, wow.
Sometimes
Oh,
someone has
okay.
to drive it, then we have to
Okay.
run it here.
Yeah.
But if you want to do blood
That's
work like a
okay.
week before, then that can happen.
Oh,
Right.
Yeah.
You have enough time.
we're just trying to, it always tells us to come the day before. Well, that's 2 trips to Stanley, so
Right. Or you can come the morning and wait till
Yeah.
the afternoon. If you want to do
Yeah.
that.
we'll just leave that.
So, do you want to talk to Dr. Omen about removing the testicles? Or you're sure
No,
about
I don't think I want to do that.
Okay, so maybe the shot, maybe not.
Maybe the shot. Yeah.
Maybe the
Yeah.
shot.
Yeah.
Can I print you the name of the shot so you can read about it?
Yes.
Oh, yeah.
That would
Good.
be great.
And then if you want the results of the scans, the nurse at the front desk can print you everything.
Okay.
Okay.
Good. Any questions for me?
I think that's it. We know how to get a hold of you.
Do you need
Just-
pain medications for the pain or it's not that bad?
No, it's kind of went away now.
Excellent. Yeah, you can try lidocaine patch.
Oh.
It's over the counter, icy hot.
Okay.
You can put it where you hurt. And
Okay.
Tylenol. Ibuprofen is not the best for the kidneys.
Right.
It can cause kidney damage.
Yeah. He's got some oxycodone left.
Sure. Yeah, that you can
He's
take.
got some from, I don't know, whatever it was before.
Sure. So wait here a minute and we'll print you. And if
Okay.
you want this,
Yeah.
this summarizes the scans.
He would just like a picture of the scans,
Yes.
just to see.
So yes, this is
How it's
February, this
changed.
is May.
Okay,
And this is the PSA. But the
okay,
nurse will be here with the name of the drug so you can read about it.
okay.
Excellent.
Thank
Alright,
you
here
so
we go.
much. Appreciate
And
it.
if the pain gets worse, you need pain medications, call me.
Okay,
I'll give you a
thank you. Appreciate it.